On page 231, table 12.2, we look at some of the common steroids. And once again, we've talked about steroids in a couple different chapters and their side effects. But with musculoskeletal issues, many times steroids are ordered because steroids have a really good anti-inflammatory response. So the uses for steroids and therapeutic results, we can use them for acute adrenal emergencies if you're not producing enough of the corticosteroid yourself. Allergic states because they suppress the action of the immune system. Acute brain injury, they can be very effective for the swelling when the brain is injured and tries to swell up against that bony skull. Asthma, other respiratory conditions like COPD, and any condition in which acute inflammation can add to tissue damage of some kind. So we know with steroids you're going to retain sodium, and what follows sodium? Yes, water. So you're gonna have more water in your system. You could have increased blood pressure. You might gain some weight, partly because of increased water and partly because sometimes the appetite really gets increased. The skin is affected. You can have stretch marks and bruising over a period of time. And reduced immunity. If somebody's taking chronic steroids, they have to be very careful when they are around other people because they can end up having a decreased immune system. Very dangerous at times like these. In severe cases, you can get adrenal gland suppression. With these medicines, it doesn't take very long at all for the adrenal gland to say, oh, look, we don't have to make any more steroids because they're being given to us. And so the adrenal glands will sort of shut down fairly quickly in response to steroid therapy. That is why when it's time to stop the steroids, you have to taper them. You never stop abruptly because your adrenals will be totally caught off guard and they won't have a chance to go ahead and go back to making their own corticosteroids like they're supposed to. So you can end up with some really, really severe rebound effects. So adrenal gland suppression and long-term reduced immunity are your big adverse effects to steroids. Steroids don't interact well with barbiturates, sedatives, narcotics, definitely not with anticoagulants, and oral contraceptives don't work as well. Lots and lots of considerations when somebody has to be on steroids all the time. They never will do chronic steroids lightly, although it's pretty common to give steroids temporarily for respiratory problems and other issues like that. Patient teaching, nursing implications are found on page 234. Folks have to know to keep their appointments. They should not smoke. Steroids are very irritating to the GI tract, so is tobacco and nicotine. Avoid alcohol as well, because that also affects the GI system. Like I said, never abruptly stop steroid use. Don't just quit. You have to taper. Even a short-term Medrol dose pack for allergies or upper respiratory stuff, they're going to start you on maybe 5 or 6 a day and taper down to where you're just taking 1. If someone's on chronic steroids, they should use a medic alert bracelet. And it's a good idea to take steroids early in the morning if you have a choice, because they can sometimes make you more energetic. Sometimes people report difficulty sleeping if they're on steroids. So that's kind of a short little section. So I'm going to stop here. Remember all those steroid side effects that you got given back in chapter 16.